In this video I'm going to talk through transverse frictions with you. So this is a very aggressive technique and you need to talk through your client carefully about this and make sure they've signed for consent for treatment. So a transverse friction, the idea of it is to stimulate an inflammation response. So you're actually damaging the tissues to be able to restart repair maybe. So if you've got an area that's been healing but for some reason has stopped, you can friction it and that will irritate it to start again. It can be used to break down adherences. It's one of the methods you can use. So when you do it, say we're talking about the erector spinae group here and you have an adhesion or scar tissue here that you'd like to treat, you treat at a 90-degree angle to the tissues. So your fibres run this way, so you're going to treat this way. Obviously, depending which muscle it is, depends which direction you treat. So you do need to know the direction of your muscle fibres. For example, if you look at infraspinatus, your muscle fibres come in a fan. So they come from, let's find the scapula here, they come from here and they come fanward into this area. So you need to think quite carefully about what angle you're going to friction at. So back to your friction, you can use reinforced thumbs, reinforced fingers. You can use elbows, but again you don't have the control. You can use tools, but I think you lose a lot of the feeling there, so I think usually thumbs or fingers is best. And this has to be a very deep friction, so you're pushing in as far as you can and then you friction back and forth across that area. And you do it for about 10 seconds or so, you release and then palpate. So I can't do it because Paul doesn't need the treatment, but you do. You go in really, really deep, lots of pressure, and you go back and forth in this direction. So that's your frictions.